I wanted to start off really quick and say, just in case it seemed like last time when I was talking about fear in hospitals and how fear was introduced, that I don't want to demonize hospitals and the medical field or anything like that. There are some things that they do, protocols, procedures that they do, they're unnecessary and put babies and mothers at risk, and even other patients. But there are also many ways and many areas that we're so grateful for them, so grateful for them. I've been, there's been mothers that I've been so grateful that we had the hospital to go to for certain circumstances. And even people who just plan on having their babies at the hospital, like it's wherever they feel comfortable with where they should be. And there's been amazing hospital staff that I've worked with. There's been some that are not so great, but there has been, and for the most part, they're just really good to work with. I just feel like wherever you want to give birth is where you should be. That's how I feel, just because I'm a home birth midwife. Mostly it doesn't mean that that's what I feel like everybody should do. So I just want to make sure, just in case it came across like that in the first class. I'm also doula in the hospitals, and I sometimes have had ladies, all of us on our midwifery team have had ladies partway through just like, actually, I just feel like I need to be in the hospital for this baby. And then that's where we're just like, okay, we don't try to talk them out of it or anything. We just, if that's where you feel like you need to be, then that's where you should be. So anyway, I just want to make sure I got that in there. Are there any questions from the reading, from the last class, information that was given at all? Do you guys have any comments on any of it? Okay, so because we didn't get to last time, I know we're a little bit short started now too because the tripod is just being silly. If we guys can just do some quick introductions, I just think it's nice to kind of know who you're in the class with. So a few things, just maybe tell something really quick about you that's maybe interesting if you want to. And you can tell if this is your first baby or multiple, like another baby. I think most everybody in here, this is their first baby. And then if you happen to know what the gender of the baby is, or if it's a surprise or whatever, just your names and those few things. So if it's okay to start with you guys.
Yeah, sure.
Sorry about the light.
No, you're okay. I'm Logan, this is my wife Gracie. We're having a boy, and yeah, that's about it.
First baby.
First baby, yeah.
Okay, if you guys can go ahead. Sorry, I just gave your name away. And you don't even have to stand if you guys want to sit and say it. Sorry, I should have said that in the beginning.
That's fine. My name's Laura Baker. This is the first baby. It's a surprise, and I'm excited, so that's all I say.
Super fun.
My name's Jaden Baker, and first baby both ways, so pretty excited.
So cool. So you're going to have twins.
Basically, yeah.
Okay. Do you want to go ahead? Oh, sorry, you didn't do. I was thinking you just introduced her for a second. Sorry. Go ahead. You are your own self. You get to introduce yourself.
I'm Grace Baker, and we're having a girl.
My name is Brooklyn Thompson, and it's my first baby, and I'm having a boy.
Great.
My name's Rick. This is my wife Lexi, and we're having a little girl.
You guys can go ahead.
I'm Luke. This is my wife Leanne, and we're having our first little girl. So.
Right.
I'm Mitchell. This is my wife Kel, and we're having our first baby, a girl.
I'm Brock, and this is Cicely, and we're having our first baby boy.
Right. And just first baby too, right?
Yes,
Not just first baby boy.
first baby.
Just in case it.
Hi, I'm Adria, and I am having a girl. It's my first.
All right. Okay, so you guys all know me. I'm Shauna. I have 9 children. I've been in the midwifery field for 16 years. Been delivering babies of my own as the lead midwife for about 12 years, 13 probably. I absolutely love what I do. I've been teaching these classes for 12 years, And every time I teach them, I go back and I add more because I go to births and I like, oh, these women need to know this. And I also doula in the hospitals. And so I love everything having to do with fertility, birthing, babies, life. I'm so passionate about it. So I also am a Mercier therapist. I work with ladies who struggle to conceive, and it's a special fertility treatment and journey that we do with them, fertility work that we do. So I love it. I feel like God has led me to be here, and I am so grateful, and I'm just in awe and amazement and just honored to be a part of birthing every time. I think I said already 9 children and then almost 4 grandbabies. I'll have my 4th grandbaby in November. So excited about that. One just really interesting thing about me, I love to go fast. I had the hardest time driving. So I want to drive a race car on the racetrack so bad. So bad. I feel like if there were past lives, that I'd be a race car driver because I just want to. I have the hardest time going slow. So all my kids will attest to that. And luckily, I need to knock on wood, have only gotten 2 tickets in my life for speeding. So, one time it was because I passed up a Bronco that was undercover cop who wasn't very smart. But anyway, so just a little interesting thing there. Okay, so I just love this quote. So I threw it on here for this next class. Just as a woman's heart knows how and when to pump, her lungs to inhale, and her hand to pull back from fire, she knows when and how to give birth. It is so true. It's just, if you let go and let your body work and give away that fear, give into what your body can do, then yes, and please, like any of these slides, feel free to take pictures of them. If you want actual copies of them, write it down in your notes and let me know, and I'll get them printed out for you. Also, there's a lot that I will say that's not in the slides, that's not in your booklets, that's not in the hypnobirthing books. Probably not a lot, but some. So if anything stands out to you and you're like worried that you're not going to remember it, just please write it down in the notes section in the beginning of your booklet. And maybe, you never know, maybe it will help you in your birthing, postpartum, whatever. So you might never use it, but just in case. Better to have it and not need it than need it and not have it. So, okay. Falling in love with your baby, that's what we're going to talk about here today. Pre-birth parenting, preparing your mind and body, even more so. This whole course is about preparing your mind and body. It's kind of blurry. This whole corner is going to be kind of blurry, so I'm sorry. It just says we have a secret in our culture, and it's not that birth is painful, it's that women are strong. And I love that. I love that quote, and it's so true. Okay, so falling in love and bonding with your baby. Babies are active participants in pregnancy and birth, and I know that probably most all of you, if not all of you, already know this, that they are aware of their surroundings. They're aware of mother's emotions. They're aware of what is going on, like they can hear all that. There's a lot of studies that have been done. We'll go into that. Time spent bonding reinforces feelings of security, helps to make babies more active participants during the birthing. Babies remember birth experiences. There's a cellular memory that we have. So we all have our neural memory, but we also have memory within our whole cellular system in our body. And we retain that memory, and whether we can recall it or not, but it actually becomes a physical part of us. And we even pass that memory on, that cellular memory on to generations down. So it's, I don't know if you guys have heard of emotion code or like foot zoning, things like that. That's kind of what it is. You can connect things that you're struggling with or that your habits or tendencies with clear back into your ancestors, the things that they would do. And it's because of that cellular memory that we carry with us and we pass on. It's so fascinating. Whole nother class to go into it. Emotions cross the placenta just as food, fluids, drugs do. Feelings of security can and need to be reinforced through positive, loving interactions with the baby and even through positive emotions. Babies respond when exposed to surroundings, negative or positive, emotional upsets, ups and downs from mother, and even ups and downs from the family members closest to them. So I just want to tell a story really quick. So part of our training is to make sure that we know how to resuscitate newborn babies. This is a training that like not even EMTs do, just because we're with newborn babies so much. We need to make sure we have that training. So one of these trainings that we went to get recertified, they were talking about this same idea here that I'm explaining. And so part of this class, they showed an actual ultrasound of just, you could see the baby moving around in the ultrasound video. And you could hear in the background a couple talking, and it was an Italian couple. So I couldn't tell what they were saying, but they were just having this normal conversation. And the baby just moving around normal. And all of a sudden, just out of the blue, the husband or the male voice just started yelling this angry, just like you could tell it was just so angry of a voice. And the baby just closed its arms in and tucked in and just went into what we call the fetal position and just held super still. And so like that just, like you already kind of know that babies are aware, but it was feeling its mother's emotions, and it could tell just, you know, from the voice, the anger in it, and it was trying to be protecting itself. So let's see. So baby responds with the pulse rising, movements slow down or quicken. Either one can happen. I see this in birthing so often. The baby's heart rate either rises or drops, depending on what the mother is experiencing during birthing, and also babies, of course, experiencing the birthing as well. And so if it's super stressful, the heart rate tells us a lot. If the baby can tell it's stressful to the mother, or if it can tell, you know, if baby's in distress, that tells us a lot. So also throughout pregnancy, it can tell us those things. Babies in utero react to vibrations, playing, stroking, tapping, rubbing, squeezing, massaging, voices, conversations. I don't know if you guys can see this, it's kind of blurry, sorry. Teasing, singing, reading, and siblings. See if I can, at the break, I'll see if I can get that to not be so blurry. And music played, energy work, and energy of the mother, energy of the people around them. Loud noises, humor, and heat and cold. Sometimes one of the therapies for getting babies to turn to a different, for optimal position is hot-cold therapy. So the best time to start is now. Both parents have a great influence on their preborn baby. Both parents, not just the mom, and we'll get into that in just a minute. But experience the pregnancy and plan the birth together. That's one of the reasons why I highly encourage the husbands to come if they can. So I'm going to actually start a video really quick, and I have to go back. Sorry. If anybody knows of an area that we could do these classes that's more room, let me know, and I would be super grateful to have that. Okay. Sorry, I don't know why this is doing that. I had it already. There we go. Okay, I'm just going to show you guys this video.
Right now in America, we have this terrible crisis in our children. just all sorts of really very bad things are happening for children, and as a result of that happening by children.
We have an epidemic in this country with children with attention deficit disorder. We use about 80 to 90% of the world's Ritalin. We're the only nation in the world that drugs our children.
The third highest cause of death in American children between the ages of 5 and 17 is suicide. Never before in all of history have we had a culture whose children start committing suicide. And yet at that very time when there's such a crisis is happening, we're discovering so much about that newborn infant.
It isn't just the physical survival we're talking about here. We're talking about the whole value of human life that is in jeopardy, that we're creating a society of people who are violent, who are scared, who don't trust, and it doesn't have to be that way.
I think we have the chance to erase all forms of violence through the proper approach to pregnancy and birth and the first 3 years of life alone.
Hi, I'm Noah Wiley, and this is my son Owen. Having a child has been an amazing experience for me. It seems like every day I learn something new from Owen about how to be a father. As I discover more about who he is, I am filled with wonder at how strong and intense his presence already is at this early age. There's something about that sparkle in his eyes that I never wanted to lose. As we search for ways to keep our children's spirits intact, we look to both cutting-edge science and older ways, traditional cultures, to help us find the answers. The message we are getting from every place that we look is that humans from every stage of life, from conception on, require love, acceptance, and acknowledgement in order to develop. What babies want is to be loved and respected as human beings right from the start.
What you got there?
Baby sister.
Usually, we all start whole, complete, fine with ourselves. However, sometimes things happen along the way that teach us that we aren't okay, or that we aren't lovable. School shootings, learning disorders, drugging our children, suicide from age 5 to 17. What happened to these children to bring them to this point? Rather than fall into the trap of blaming the children, we could look to our own actions and beliefs about what children are, about what babies are. Let's examine what's happening for children right from the beginning of their lives and explore the question, how can we help our children grow into their authentic selves and keep that spark alive?
I think it starts at the beginning. It starts the way we are carrying our children, the way we are birthing our children, and the way we're caring for them afterwards. And the way we were birthed and cared for. Because we pass it on.
I think one of the most exciting things about the whole 20th century is coming into full awareness of what's involved in the birth process.
From all of our studies now, we know that the baby is far more sophisticated than anything we ever gave it credit for being before. We didn't think it could have an experience. We didn't think it could sense anything. And we didn't think it had the brains to know what the senses were telling them. Babies seem to have a working mind, which is part of their consciousness, part of their human consciousness. It's not something that develops in stages like the brain develops in stages. The mind is simply a part of who they are. That's a whole new idea.
When people have recalled what happened very, very even at the earliest of conception in the prenatal period of birth, their level of recall of what they talk about goes beyond what they have the brain support to remember.
Psychology wasn't digging into that ground. But now, very clever experiments are designed to use the simplest behaviors of the baby, so the baby can tell us that it's listening, or that it cares, and that it remembers.
Ultrasound allows us to peer into the womb and watch the behaviors of babies even before they are born. We've discovered that they are already interacting, and in the case of twins, responding to each other.
In one pair of twins that were observed beginning at 20 weeks of gestation and followed for a couple of years after birth, when they were 1 year old, their favorite game was to take a position on either side of a curtain and to begin to touch each other through the curtain and begin to giggle and stroke each other from either side of the curtain. This was a behavior that was observed at 20 weeks in the womb. They were in separate little sacks, and the one boy who was very active would come up to the sack and awaken his sister, get her excited, and she would always respond, and they would play together on either side of this curtain. They remembered that, of course. They had learned that in the womb, and they continued to do it, and we could see it both before birth and after. Babies are extraordinary communicators, and we hadn't thought that that would be possible. By communication, I mean the baby is in communication with the mother and father. The mother and father is in communication with the baby, whether they know it or not. So the signals are traveling back and forth constantly between the baby in the womb and the mother and father, although they may be just oblivious to that fact. Usually mothers intuitively start talking to the baby, and they were right. I think there have always been parents who knew this thousands of years ago, and they did all the right things without having any science to it at all. They did it intuitively, like the Tibetans. The Tibetans knew all along, for thousands of years, that their babies were real beings, and they started to communicate with them very early. They started to reorganize their lives around the coming of the baby. And they felt the baby was bringing a gift, might be a teacher for them. They could understand that the baby had a spirit, a soul, was a being, not a blob.
I knew the moment that I conceived him. It wasn't about, yeah, I love you and we're going to have a baby together. It was really about, let's ask this teacher, let's ask this person to share our lives with us.
With children, we tend to think that, it's only after we have given birth to them that, they are, worth investing energy. But in my
Started probably in the late 90s and, carried on to the early 2000. But I just want to say, even just in the 16 years that I've been in the birthing field, that I've seen leaps and bounds of hospitals moving towards more natural protocol or more what's the word I'm looking for? Helping the mothers and babies stay together as much as possible. It's gradual, but it's happening. And there's a lot of hospitals that really push for this and encourage this. And there still are some out there, like the high-powered hospitals that he was talking about. Those high-powered hospitals, they don't know what to do with the baby that's fine. I've seen it before, actually, personally. they want to rescue a baby. They just want to have a reason to rescue a baby when the baby's just fine. So yeah, I've seen that firsthand, but it's really interesting that we, you know, in the natural birthing world, have always pushed for skin to skin, and we've always pushed for, you know, that bonding, that golden hour, things like that, breastfeeding as soon as possible. But it really is a new idea for the hospitals, but there's a lot of them that are implementing that now. In fact, even just about probably 12 years ago, 11 years ago, when I first started teaching this class, my sister was a labor and delivery nurse in the American Fork Hospital, or Temp Hospital, I can't remember which one it was. And they were, implementing these new found, protocol and procedures that they were going to do. There was these new studies that the doctors were excited about, and the hospital labor and delivery staff were excited about to teach the labor and delivery nurses, and it was skin-to-skin bonding. Like, this was a new idea. So, you know, 12 years ago, this was a new idea, and a lot of the nurses were upset. They're like, we have to do this? This is going to take so much of our time, oh my goodness. But they've come a long way. It's been 12 years. Another thing, too, is when we teach these classes, and we'd have ladies that wanted to deliver in the hospital, there was hospitals that the labor and delivery nurses would be upset if they mentioned that they'd taken the hypnobirthing classes, because they're like, oh my goodness, now they're not going to want an epidural, and I'm going to have to work with them. It's just going to make my job harder. But now, you know, just for an example, I was a doula for a lady in the hospital, and I usually just introduce myself as a friend, because I don't want there to be that conflict there, or the nurses get their guard up if they hear that I'm a doula, because sometimes they do. They feel like we're going to invade their space. So I didn't mention that I was a doula. I just said I'm her friend. I'm just a family friend. And, you know, introduced myself. We made introductions when the lady was checked in, admitted to the hospital. And after a while, this nurse coming in and, you know, checking on the mom and in and out, and then afterwards, she's like, are you her doula? And I said, yeah, I'm her doula. She's like, oh my goodness, I'm so glad you're here. You guys make my job so much easier. So just so you know, there's like, there are things that are trending that way, and we're so grateful. There's still some work that needs to be done in some of the hospitals, and with some of the hospital staff, even in the hospitals that are more, sometimes it depends on what nurse you get, and we'll definitely talk about what you can do if you get those, if you end up in the hospital, if you want to be in the hospital, whichever it is, if you get that staff, the things that you can do. That's why I highly encourage having somebody with you, and I'll talk more about it in the next class, having somebody with you as an advocate. So if you don't know, because they do have their standard of procedure, and they do have their protocol that they will follow, and it doesn't necessarily mean that it needs to be done, that it's necessary, it has to be done, but they just do it because it's standard. It's just standard procedure. And so it's nice to have somebody there who knows, you know, this is necessary, no, this is not, to ask, you know. So those of you who've chosen home births, then one of us will go with you to the hospital if you happen to end up there, or if you know, if you don't, if you're choosing a hospital birth already, then it's just nice to have somebody who knows and you can ask questions to. So and we'll talk more about it in the next class. I just wanted to throw that in there before I forget, and we'll talk more about like what kind of questions you can ask. And it's so good to be informed. It's so good to be like, well, you're telling me that I should do this, but, and you can even do this at home births. Like, if you ask questions if you don't know, if you don't understand what's going on, ask questions, and it'll help you be more at ease.
What is a high-powered hospital? I've not heard that.
So like a high-powered hospital would be where they have specialists. So there's an OB, and then there's, for example, an OB, you know, just a regular obstetrician. And then there's an MFM, which is a maternal fetal medicine, where they take care of ladies who are higher risk for complications, and the mother or the baby is either higher risk or both sometimes. And those are places like usually IMC in Murray. That one's like a high-powered hospital, and they have specialists there. So that's what I mean by that. That was a good question. I'm glad you asked me. And they really do just want to rescue the baby. I've had just tell a really super quick story. Another client of mine who was planning a home birth but ended up, she had actually blood clots in her lungs. She had to deliver with the maternal fetal medicine obstetrician, and because she was taken care of and baby was taken care of, because she had these blood clots, they were worried that the baby would have issues breathing when it was born, oxygen issues, to try and put it simply. But the baby was born fine. He was doing what most babies do, is just kind of, they'll just kind of, I'm trying to explain it in a simple way. Grunts sometimes, won't breathe super regularly, just kind of maybe hold their breath and then breathe, just little things that sometimes babies just need to come around, just need a little bit of work to come around. And the baby's color was great, and they took that baby away from that mom, and they were just working at it, and I just kept saying, and the baby just kept getting worse and worse. Like the color started going purple, the baby was crying more, and I just kept saying to these resuscitation team ladies, I said, can you just put the baby on the mom's chest and let's just see how the baby does? They're like, oh, they were just so mad at me. And I tried to do it gently, tried to do it kind of, they were so mad at me. Like, no, we got to do this. And I'm like, can we just see? If you don't, just bring it back. And then so long story short, as soon as they got the baby on the mother's chest, baby resolved. He calmed down, his color went pink, his breathing regulated. So anyway, they just wanted to rescue the baby. So, doesn't always happen though. A lot of times they're very, willing to hear and listen. Okay, a loving husband is a source of energy and security to his wife and their baby. By giving them his comfort, encouragement, physical strength, and full attention at the birthing, he can greatly reduce the hours required for her labor. Just like I mentioned in the last class, I've seen this over and over again. I've seen where husbands are distracted, maybe on their phones or talking to somebody else in the room, and the mother just keeps looking over at him, not there actively supporting and participating in the birthing, and you can see that stress on the mother's face and her body language and the tension in her body. And then on the other flip side, when you see that husband just there and eager to give whatever support he can and whispering things in her ears and holding her hand, or sometimes when he's even like being yelled at because he's doing the wrong thing and he doesn't mean to, but he's just like, sorry, what can I do? And realizing that just, the mother is just in not her normal self in this moment, and just willing to just be there for it, is huge. I see it over and over again, how beneficial it is. Okay, so if you guys will just turn to your first page in the class 2, it says a mother's conversation with their unborn child. Sorry guys, deal with that. Gracie, do you mind reading that for the class? So we're going to have Gracie read that.
Dear little baby inside me, I want you to know I am involved in a wonderful experience. I am having a baby, and you are that wonderful baby. I welcome this experience with such happiness. I can feel the changes taking place in my body. My womb has become a temple of joy because of you. I can feel you grow within me, and my body swells with pride. I love the way I look. I keep myself looking neat and fresh. I'm taking good care of myself for both you and me. I'm eating properly for both you and me. I take pleasure at the thought of your moving inside me. My life combines with yours in love. I'm preparing myself for the time when you will be born. I feel you within me, strong and healthy. I'm carrying you with such loving pride. I feel the exciting bloom of being pregnant. I have a beautiful glow about me because you're in my life now. I nourish you with love and take care of my body. I'm learning to relax more every day. I look forward to your birth with such joy. I'm confident about your easy birth. I'm practicing relaxation so that you can move easily and comfortably into this world. All doubts are put aside as I look forward to your birth. I keep my mind calm and peaceful so that you can be calm and peaceful. When you're born, little baby, I will give you love so that you may grow myself and others. I promise to talk to you in such a way that you will listen, and I promise to listen to you in such a way that you will talk. I will respect your right to be yourself, and I'll try to help you to learn to respect the rights of others. I promise to encourage you to seek answers that will lead you to know and appreciate this wonderful world around you. I promise to teach you with love and guidance rather than anger and punishment. I will teach you and I will learn from you. I will provide opportunities for you to help you grow in love and happiness. I see you, little baby, coming from my womb, and I see you cradled in my arms. I'm elated at the thoughts of your coming to me. Your little baby, I love you.
Thank you. I love that. I'm so proud that that was a part of it. So if you'll just turn to the next page, and then again, if I ask you guys to read or comment or whatever, then you can say no. But Rick, will you read this next one?
Yeah, of course.
Thanks.
Parents' prayer. Dear God, help us to be better parents. Teach us to understand our children, to listen patiently to what they have to say, and to answer all their questions kindly. Keep us from interrupting them or contradicting them. Make us as courteous to them as as we want them to be to us. Help us to never punish them for our own selfish satisfaction or to show our power. Let us not tempt our children to lie or steal, and guide us daily that we may demonstrate by all we say and do that honesty produces happiness. When we are out of sorts, help us to hold our tongues. May we ever be mindful that our children, and we should not expect them to act like adults. Help us to never rob them of the opportunity to wait on themselves and to make decisions. Bless us with the bigness to grant them all their reasonable requests and the courage to deny them privileges we know will do them harm. Make us fair, just, and kind parents. We pray for calmness, poise, and self-control, and fits us to be loved, respected, and imitated by our children.
Okay, thank you so much. I love both of these as parents' prayers, something that I for years have been wanting to, I say it in every class too, and I still haven't done it, to hang up on my wall, because it would be a good reminder to me in so many ways. And so I love these to be seen now, because I feel like you all are parents already. That's how I feel in my heart, that even though your baby hasn't been born yet, you still are parents. And the more we work on before our babies come, the better parents will be when they get here. So, okay. I love this. Russell Crowe, because he's a dad, I don't know how big of a person he is now, but long ago, I found this quote. It says, "Some people have bad advice. Some people have horror stories. I like it when people look you in the eye with a glow and say, it's going to be cool." So just like, that's what I hope, that you'll focus on that. It's going to be cool. Like, stop listening to the horror stories. You know, if people are going to want to tell them, people are going to want to tell you their horror stories of their births. And, you know, it's okay. You can be respectful and listen, but, you know, then plug in what you want for your birth after you hear that story, and try not to focus on that. Try not to dwell on that story that you've heard. It doesn't have to be, even if it was your own mother. Because there are a lot of mothers out there who are like, oh, this is gonna happen in your birth because it happened with me. And yeah, I know, I had this happen, and so it's gonna happen. All my babies, this and this happened, and so you just gotta plan on that. And that is not true. I wanna tell all of you right now, just because something happened with your mother, it does not mean that it's going to happen with you. Sometimes it does happen. I think a lot of times there are genetic things that happen, but for the most part, just because your mother had certain experiences with her birth, it does not mean that you're going to have those experiences. And a lot of times that idea gets imprinted into the mother's mind, the birthing mother, the pregnant mother's mind, before her birthing, that, oh no, that's going to happen with me. Even though she wants to push that aside, but because she hears it so much. So it's okay to kindly and respectfully say, you know, just don't say that to me anymore. I don't want to hear that. I know, or, you know, whatever way you want to say that maybe is better than that. I want to hear positive things about my baby and my birthing, you know, for this birthing. That may have happened with you, but I want to hear positive things. You know, it's okay, because I've seen too in births where that mother does get in her daughter's head, and not meaning to, just well-meaning, they just, and she's telling, and that does sometimes happen. I can't say for sure that it wouldn't have, without that, but I think it's just enough of a pattern that I've noticed that makes me wonder. So that incident will happen the same as the mother's in that lady's birthing, that the mother kept saying, oh, this is gonna happen, this is gonna happen. So plug in what you want instead of the story that you hear. I want to also say, go back to this, about the dads. I told this story, I think Luke's heard it before, but I've told this story in other classes, but I just tell it because it is so neat and it is so real, and it shows so much how these babies hear and understand, and they know. So when I was first being trained as a midwife, I had this, and I was working with this midwife. We had this Native American couple that we were taking care of, and the husband, when he would come to the prenatal appointments, was so quiet, hardly ever said a word, but you could tell just from his demeanor, from his body language, from when he did speak, that he was just a kind, gentle person. And you can just tell. So we did with that midwife, we did what we call home visits before, like 36 weeks, 35 weeks gestation. The mother, we would go to their home. So we knew where they lived in case it was the middle of the night. We didn't have maps back then, the Google Maps and stuff like that. So we'd go and see where they lived, and we'd see where they wanted to birth, and get an idea of how she wanted her birth to play out. And so when we walked into this couple's home, you could tell that he was where he was comfortable, so he was a lot more talkative, but they had two little girls. And these two little girls were just like, Daddy, Daddy. They wanted to be with him the whole time. They were hugging him, he was laughing with them, playing with them, talking to them, and you can tell that he was a very involved, loving dad, just watching him with his girls. So at the birthing, this baby was born, and like you hear the word papoose, and you imagine these fat little babies and the squinted eyes, and that's what this baby looked like. He was just so fat and roly-poly at birth, like just right when he was born. It was so cute. So babies, this might seem like a silly thing to say, but some people think that babies don't open their eyes at birth, but they do. Most every baby opens their eyes right away. So this baby, so the mother had her baby in the bathtub, and so from the time that we got her taken care of, the placenta came, and managed her bleeding, got her cleaned up a little bit, and then got her to her bedroom on the bed and settled. The baby still had not opened his eyes because they were just like so fat of cheeks, and they were just squinted shut, and he just still had not opened his eyes. And we were all kind of laughing about it, how cute it was, how chubby he was, and he was breathing fine, doing great. All of his other signs were great. He just hadn't opened his eyes yet. So the mother got this baby settled in the crook of her arm, was trying to get baby latched on to breastfeed, and the husband came around this side and just leaned over his wife's shoulders and said, and he just was watching for a second and then said, "Hi buddy, I'm so glad you're here," or something like that. And I'm not even kidding you, this baby cranked his neck back to see where his dad was and opened his eyes wide just to see his daddy. We're all just like, oh my goodness, where's the video camera when you need it? Because it was so like obvious, and just that baby knew his daddy's voice, and he knew that he wanted to see him, and that he was safe, and it was just so incredible. So I just wanted to add that in. Okay, selecting caregivers and birthing. I'm just going to go over this quickly because most of you guys have already selected it, but the reason why I like to go over it is because sometimes it changes. Sometimes women are made to feel like they need to do a certain thing. They need to go with a certain midwife or an OB when they really want to be at home, or they really want to be in the hospital and they're pressured to be with a midwife. So a bunch of different things. So obviously you know what your choices are. There's the home birth midwife, birthing center midwife, certified nurse midwife. The certified nurse midwife they work in a hospital and they work under the direction of an OB. So sometimes they're a little bit more natural minded, sometimes they're not. I'm an obstetrician or OBGYN. is generally what you would be seeing if you were delivering in a hospital. And there are some great ones out there, and there's some that we would say, if I were you, I wouldn't see him. So, hiring a professional doula or using a personal labor companion, I highly recommend you at Home Births. We have those on our team anyway. And then there's lots out there. So, environment, the environment that you'd be birthing in your own environment, meaning your own home, or a family member's or friend's home. Some people don't feel comfortable giving birth in their own house for some reason or another, and so they'll ask to go to like their grandmother's house to give birth, or their aunts or their mothers, or and that's great. I just highly recommend that you go where you're comfortable, like where you feel most peace, and most at ease. Because it will greatly determine how your birthing goes. If you're somewhere you're not comfortable, then it will have an impact on your birthing. For the most part, that's what we see. Hospital, baby's choice, it's kind of blurry, but this says baby's choice, car or roadside. Sometimes that does happen. We've heard of several incidences where it has. And in this case, I just want to say it's not a time to panic. Most of the time, probably 99, 98% of the time, the babies are doing great. When babies come that fast, they're doing great. Their breathing is great. Their color is great. Their tone is great. You want to for sure call 911. Have them walk you through things. But if they do tell you to cut the cord, don't do it. Okay? Just don't. Just say, you don't need to argue with them or anything like that. Just keep the cord on. It's better for mother and baby. Okay? They'll walk you through stimulating baby and things like that, but just really not a time to panic. Just stay calm and call 911.
Shauna,
Yeah.
what would you recommend then if to not cut the cord? Like,
Just leave it on. They'll tell you to find a shoelace. They'll tell you to find something to like take your own shoelace off, or grab a string or something, tie it off, and they'll tell you to tie off one end here and one end here, or two places, and then cut in between those two places. First of all, it's not sterile, and second, it's better for the baby to have the cord attached until the cord stops pulsing. So the only case that I would say that you should cut the cord before it stops pulsing is if baby's head has presented and the cord is around the neck so tight that we can't move the cord and baby can't come out all the way. So of course that would be a strangulation issue, and so we would want to get in there and we would cut the cord. That's the only time that I could think of right now. But and we'll go into the cord and delayed cord clamping more in the last class too.
Can we go over how long the pulsing, like you said, lasts for?
It actually varies. So some babies, we've seen the pulsing stop. So let me show you really quick. It is something we'll talk about in the last class, but I'll go over it really quick because it's a question. So when baby's born, okay, so baby's going to come through the pelvis, and it's going to come, actually, there's going to be a tear in the sac the baby's going to move through. So it's going to come through and be born, okay? And then placenta is still going to be, I'm actually going to leave this here, so, okay, so pretend like the baby was in the sac. Okay, baby's going to move out of the sac as baby comes out, but I'm going to turn baby this way, because that's the way you want baby to be born, where you don't see face presenting. So baby's going to be born, okay, and then it's going to come through. You're going to put baby up. Sorry, it is some work to get the baby out. So, and then we're going to put baby up on mommy's chest, okay? And we're going to keep this cord attached. We're going to watch it, make sure it's not pulled on. And right here, we can feel a pulse, and it's a very strong pulse, and it is so incredible. Like, you can feel your pulse on your neck and your wrist, and it's even stronger than that. And what is happening is the placenta is feeding blood through the cord to the baby, and it's necessary blood that the baby needs. So delaying that cord clamp, or cutting that cord, clamping and cutting that cord too soon is depriving a baby of, like, say an adult needing like a pint of a transfusion, a blood transfusion. So it's equivalent to about that, give or take, you know, depending on the baby and what the baby's needs are. So this organ here that your body grows for the baby is so fascinating. It's like another brain, it's like another liver, it's like another lung for your baby, and it knows what to do in most cases. Well, there are special circumstances where, you know, the placenta is not functioning like it should be, and then sometimes in those cases then it won't be giving adequate blood to baby, but that's a special circumstance. So in most cases it's going to continue to pump blood from the placenta even before the placenta is birthed to the baby, and that can help baby oxygenate better, it's going to help baby breathe better, it's going to help their bilirubin levels to be better. So many benefits to that. Okay, so cutting that off too soon is just like depriving a baby of a necessary blood transfusion. So you can feel that. So we'll just check for it periodically, and we'll just feel that. And if it's not pulsing anymore, we'll say, okay, it's given the baby, placenta has given baby all that it needs of the blood, so we can cut and clamp now. In the hospital, though, I will say that, to answer your question, that can take anywhere from like 20 minutes to sometimes over an hour. I've seen it go probably close to 2 hours. That's a pretty long time, but usually it's done pulsing about, on average, about an hour, 45 minutes to an hour. So, but we just leave it, and there's no harm in leaving it longer too. If it stopped pulsing, there's no harm in leaving it. You know, we don't have to get it right when it stops pulsing. So, in the hospital though, I will say that their delay is 30 seconds. So normally they will just, as soon as baby presents, they'll get the cord, they'll hold onto it, cut and clamp. As soon as baby's born, like immediately. So sometimes as soon as baby's shoulders are out, they'll just get in there, they'll have the nurse get in and cut and clamp. So it's super important that if you're in the hospital that you say, we want delayed cord clamping, we want that. But then you need to also say, because they'll say, oh sure, you know, a lot of them, sure, I'll give you 30 seconds, or maybe a minute. But you need to say, I want my husband to see if there's still a pulse. And as soon as it's done pulsing. And some doctors will tell you, well, we can't deliver the placenta until we cut the clamp and cut the cord. That's not true at all. It happens all the time, that the placenta delivers before the cord is cut and clamped. All the time. At home births, and you can see it in the hospitals, you just really do have to push for it. It will be a battle. So that's one of the things that actually there's the most conflict that I've seen in the hospitals is with that, the delayed cord clamping, where they just really want to cut it. I don't think that all doctors want it for this reason, but I think they get a lot of pressure from the hospitals, hospital directors, because they actually make money off your placenta. I'm not sure if you guys are aware of that. So the sooner they cut that cord and clamp it, the more blood is in that placenta and in the cord, and they draw vials of blood out of that placenta and they sell it, all that cord blood to the placental blood for the blood cells, the platelets, for so many things. They sell it to pharmaceuticals for a lot of money, like upwards towards $30,000 that they're making off of your placenta that they don't even ask you about. And they just think, oh, they're just going to get rid of it so we can just do whatever we want with it. They don't even tell you, but they do. Every single placenta that they keep, and that they can get blood from, they will, and they'll sell it. So, anyway, just so you guys know, a little bit of information that's really helpful to know. And your baby needs that blood. The blood is for your baby, not for them. Did you have some?
No, I agree.
Okay.
You hope we're getting it.
Oh, so for the most part, he is. You just have to remind him. And then he'll probably like, kind of get a little bit antsy. It's just because he's so used to people not knowing.
Yeah.
So many women, so many couples don't know this. They don't know that they have an option in the hospitals, and so they're so used to, or they say, they hear about delayed cord clamping, and they'll say, can I have delayed cord clamping? And then they, oh sure, yeah. And then 30 seconds is all you need. So they think that that's all they need.
Does he let you do the skin to skin right off the bat?
You ask for it. So they will,
Yeah, we'll just share.
yep. You just have to make sure to let him know, and that's what I'll be there for too,
Yeah.
to remind him, and he knows me, so he'll know that I'm gonna be saying all the things if he doesn't remember it.
So even when you say you want it delayed, can you tell them like how long you're wanting it delayed for? Like,
Yeah.
even though theirs is like 30 seconds, if you want it to be upwards of an hour or two.
Yep,
just
you can
something.
say I want it for an hour, or you can say, don't touch it for an hour. It's my baby, it's my placenta. If they get super, because sometimes it'll be the nurses too that are getting pushy about it, not just even the obstetrician. And so if they get pushy about it, say, just leave it for an hour. Just leave it for an hour, okay?
How is that even legal that they could go and sell that?
Well, so I think sometimes the hospital staff forgets that they're working for you. They think that you are there for them.
Yeah.
And they have standard procedure, standard, so that what their protocol is, and it's like streamlined. It's like right in a row. They got to do this, this, and this, and then this is going to happen. Another thing that they do is across the board, they'll give an injection of Pitocin to the mothers after baby's born, right after baby's born, and it's not necessary. It's to help prevent hemorrhaging. But they also know that they can give that Pitocin if the mother starts to hemorrhage. They don't have to give it right away, but they just give it right away across the board just in case. And there's things that they do like that are just in case, but that are not necessary for every single person. So, and so you just have to know these things in advance so that you can say, I don't want that. And that's another thing that you can, and we'll talk about that in the next class too. Sorry,
It's called Pitocin.
Pitocin, yeah. Pitocin. I had to get the word in my head. But yeah, so we'll talk about that some more. So preparing your mind and body, I want to talk about this really quickly. But maybe we'll break. Let's see what time it is. I think we're going to just break real quick. I think everybody's kind of getting a little bit sleepy. So do you want to pause that, Christopher? And then we'll have a little bit to eat, walk around, use the bathroom, get a drink, and wake up a little bit. I'm going to turn on this light. It's going to be bright. Most women, I feel like, is my experience. So give yourself permission and tell yourself, this is good, this is what I need, this is what my body needs, this is what my baby needs for this relaxation. Establish a routine, and we'll go over that even in more detail. Find positions that work best for you. There's positions in your hypnobirthing book too, that I'll show some positions here, and it also talks about it in your hypnobirthing book. And then relax from the top of your head to the tip of your toes. So that's one thing. The reason why I put that on there is most people have an easier time relaxing when they visualize the muscles relaxing, or they focus on the muscles relaxing from the top of your head to the very tips of your toes. And if you can do that, you get relaxation much more quickly, get to a deeply relaxed state much more quickly. Breathing. So breathing is another technique. We talked about the sleep breathing last time, and there's slow breathing and there's birth breathing. And I talked a little bit about the slow breathing. These take practice, and they must be worked on daily except for the birth breathing. So the birth breathing you don't have to work on daily. I just say 3 or 4 times a week, or probably 3 to 5 times a week, and we'll talk more about that. So in the last class I was telling you that it's important to make sure that your ribs expand because of that connection of right here in your rib cage and then the lower part of your pelvis, how they're laid out the same, which means they connect. And so much of your breathing impacts how your pelvic floor works. So you guys will just look at this really quick. This is important to let your lower ribs expand, but when you do your deep breathing, you don't want to have your chest expand. You don't want to have your chest rise. You want to have your abdomen rise. So if everybody can put your hands on your belly, and you want to breathe in so that your belly rises, fill up your belly and not your chest. And what this does is it opens up that space in your pelvis. It allows more room in your pelvis, it allows more circulation in your pelvis, it allows those muscles to relax in your pelvis. And when people do this right, they actually have less pelvic issues when women will do this right, and even men do it right. There's less pelvic floor issues, there's more pelvic floor stability, things like that. So you want to fill up your abdomen when you breathe in. So I don't know if you guys will be able to see this, but so I think most of you ladies are closer to 20 weeks. Some of you guys are earlier on, but if you guys need to stand up in the back, you can, but I'm gonna get on the floor for you guys. That's how much I care about you guys. I'm gonna get on the floor. If one good way to do this, to test, to make sure you're doing it right, is to lay flat on your back. And for those of you who are 20 weeks plus, 20 weeks or more in gestation with your babies, then you don't want to stay on your back for very long. So just do it long enough to just test it and see. And then it is a little bit harder with that belly in the way, but you can still tell. And then as soon as you can tell what you're doing, then get off your back and lay on your side or just get up. But when you're further than 20 weeks. So let's see if I can, hopefully you guys can all see this. What you want to do is put your hand right here in front of your pubic symphysis, your pubic bone. And you want to relax your shoulders, relax your ribs, and take a deep breath in, and you want to make your hand move up, okay, right here. So just rest it gently, and you want to feel, so I don't know if you guys could see that. It's harder when I'm talking, but I don't know if you guys could see my hand rise slightly. So that's the kind of breathing you want to do. It's good for men too, but especially for women, and to, oh, whoops. Did that ever turn on, Christopher?
Yeah, it's recording.
Oh, okay. I guess I did turn it off. I'll probably have to redo a portion of that. Okay, so we talked about the balloon in the first class, and I showed you how the uterus works, and it's like a balloon. So you want to kind of flip that balloon upside down, and you imagine you're blowing air into that balloon, and that is expanding down here. This is expanding, and you're also letting this part of your ribs just be loose and relaxed and not expand, but you don't want to fill up your chest. So your air is going down and around baby and expanding this area. So it takes some practice. It takes working on it. It takes this kind of breathing takes practice daily to get that right. Most of us are really shallow breathers. Most of us are chest breathers. And it has a negative impact on our life too. Especially if somebody deals with anxiety or stress a lot. They breathe just mostly in their chest, and they don't get those deep breaths in. So work on those deep breaths. The sleep breathing, does anybody need me to go review the sleep breathing at all? I think we'll go over it in the next slide anyway.
I'm a little curious if it's in the next slide.
I think it might be. If it's not, I'll go over it. But and then the slow breathing, pretty sure it's in there too. The slow breathing and the sleep breathing. Sleep breathing you're going to be using in between surges and your relaxation sessions. And the slow breathing is what you use with your surges, but you still want to practice them before you're in labor, okay? Let's practice it before you're in labor. Birth breathing is for when you're moving baby down to be born, when you're complete, your cervix is complete, fully dilated and effaced, and baby's being born. That's what you're going to use your birth breathing for. We'll talk about that some more. When you inhale, like I said, your abdomen should rise. And when you exhale, breathe downward and outward towards your vagina and out, and just letting everything relax and be calm. So it's going to be down and around baby and out is what you're going to, when you exhale. Okay, and then the next technique is, the third technique is deepening. And it talks a lot more about deepening in your Hypnobirthing book. So I encourage you to, of course we're going to have the slides on it, but to read through that. Deepening mostly is just where you're relaxed and you're doing your sleep breathing, and you're doing your relaxation session, but you go so deeply relaxed that you're not quite asleep. You're still aware of your surroundings, but you're so deeply relaxed that every muscle in your body is so loose, and your core just feels calm, and you just feel like you're letting everything go, letting go any tension all over your body, and we'll talk more about that. There's different techniques that you can use, and when you try these, read about these techniques and try them, find the one that works the very best for you, and then you can keep using that for your relaxation sessions and for that deepening, and it will help you so much in your birthing. Visualization is the fourth one. So visualization, they use things like blue satin ribbons, opening blossom, blue satin ribbons for your uterus, those muscles on your uterus that we talked about in last class. And the opening blossom is your cervix. You just kind of imagine, because petals are so soft on flowers, you imagine your cervix so soft and just slowly and gradually opening like a blossom, like a flower blossoming. Whatever works for you though. Some people don't even use any of these, but a lot of people do. And so we just put it in there just in case they want to use them. Time distortion is something that happens in so many births where you think that it's been like maybe 20 minutes and 2 hours has gone by. And it's because you're so deeply relaxed and focused on what you're doing and bring your baby here that you don't even realize how much time has gone by. And it's actually a good thing, because you don't think, oh my goodness, it's been 2 hours already. You think, oh, it's only been about 20 minutes, and it's a good thing. Birth affirmations and scripts. Again, like I talked to you about last time, the scripts, try to visualize what the scripts are prompting when you're reading them, listening to them, or having them read to you. I recommend not reading them for your relaxation sessions, having somebody read them to you, or just playing the audio scripts if you like them. Visualize baby's perfect position, and that's this right here. Okay, and I'll show that again. And you do have a picture of that in your booklet that you guys can just like tear out if you want to, and I suggest hang it in a place in your house that you're going to look at the most often. Usually that's your bathroom mirror for most women. So hang it where you're going to see it most often throughout the day, and look at it and visualize it. Close your eyes and see it. See it and be grateful for it. So whatever you want for your birthing, see that daily and be grateful for it. When you can see it, you can create it. So I'm going to go over this. Relaxation, the first one. I'm going to go in a little bit more detail on this one. It's important that you establish a routine. This is super important because I'll actually just read it. So choose a time and place you won't be disturbed daily if you can, or at least 3 times per week. The same time and the same place as much as possible. So what that will do is it's going to condition your mind and body to respond quicker. Each time you go to do your relaxation sessions, your body and your mind are going to be like, oh, this is what we're doing here now. And it'll make it that much quicker for you to get deeply relaxed if you're in the same time, you're doing it at the same time in the same place, as much as possible. It doesn't have to be that way, it'll just benefit you better. And you'll be more likely to get it done. Some ladies I know have even like put in a little alarm on their phone. I'm going to go do my relaxation session. If it's like at night when you're going to bed, if it's in the morning, whenever you have time, just make sure you get it in. Turn off your cell phone so you're not having that interruption. Use soft, dim lights, and use the bathroom first, because you don't want to get all comfortable and then, now I have to get up and go to the bathroom, because that happens often with pregnancy. Wear comfortable clothing. Have a blanket nearby in case you need it, because even if you're feeling like you're warm and comfortable, you might get cold then, and you don't want to get up and interrupt, disturb your practicing, and you have to go find a blanket. So have one nearby just in case you want it. Use background music that's soft, calming, and relaxing. There's so much on YouTube that's like relaxing, calming music that you can find. We used to give CDs or sell CDs that we made up, but there's so many things on YouTube that you can find for that. Find relaxing positions that are the most comfortable for you. These can vary, and I'll show you some positions. Relax from the top of the head to the tips of the toes, like I mentioned before. And facial and jaw relaxation are super important. So just like this part of your rib cage is connected to your lower part of your pelvis, the opening of your pelvis, your jaw is actually related to your pelvic floor. And your jaw, if you clench your jaw, it actually saps energy from your body. Athletes know this, and professionals who deal with energy and stuff like that, they know that this is a real thing. I have a paper that I sometimes read. It's the Under Armour brand. They created a mouth guard, and it talks about how clenching your jaw saps your energy and it releases more cortisol. by clenching your jaw. So that's something you want to be aware of, and that we'll probably be reminded of during your birthing, because if you don't notice it, like let's relax your jaw and also your forehead too. So let's see. So relaxation, these are some positions that I was talking about. You can relax on your back, but if, like I was mentioning when I was laying down to show you the breathing, if you're 20 weeks gestation or more, then you want to not lay flat on your back for longer than just a few minutes.
Why is that not recommended?
So I'm going to tell you right here. So it shows it right here. So there is this inferior vena cava. So it's one of the main arteries that goes down your back along your spine, for men and women, of course. But the pressure of the growing baby and the amniotic fluid, the added layer of fat, all that is compressing on that inferior vena cava that supplies blood flow and oxygen throughout your body and also to baby, to the uterus. So when baby is compressing on that, the weight of the baby and all the other things involved with baby and the uterus are pressing on that, it limits the blood flow and oxygen to baby. And babies actually notice this. So a lot of mothers, I've noticed it myself, a lot of mothers will wake up with their babies just kicking, like if they end up on their backs, and they'll just wake up with their babies just kicking and moving like crazy because baby is noticing the limited oxygen supply to them, and it's uncomfortable. And so they'll move over to their side and baby will settle down. So, and also we'll notice it when we're doing prenatal appointments and a mother has been laying on her back. Some babies are more sensitive to it than others, and they will, their heart rate will be super high, like super fast because they're stressed. And we'll like, let's move you over to your side. Then we'll find, let's not have you on your back. So, does that answer your question? Okay. So, like I said, only up to 20 weeks, and the weight of the baby, the uterus, the baby, and the fluids can block the oxygen flow. So that's so it shows it right here too. So if you like to be on your back, if it's just comfortable for you, then roll up a towel or a blanket or put a pillow there so that your right side is elevated and you're more on your left side. So this inferior vena cava is a little bit more to the right side of your body. So if you're laying on your left side, it allows more of that oxygen flow to come through. So if you lay on your right side, it's fine. It's not going to be hurting you. But if you can lay on your left side more often, it's just a little bit more beneficial. So that's just if some people have hip issues and they just feel like they can't lay on their sides. So if you want to be on your back, just don't be flat on your back. Prop a pillow. In fact, I always recommend that when you're going to sleep that you prop a pillow there anyway. If you are starting out on your side when you're falling asleep, put a pillow there anyway, because a lot of times you end up on your back, and that pillow will prevent you from laying flat on your back. So, and there's also those super nice body pillows that are designed just for pregnancy that will go along your back and in between your knees, and they support you really well. Okay, let's see. So then there's also lateral. Laying on your left side is most beneficial as the uterus is kept off the maternal inferior vena cava and the right iliac artery. So have your knees and elbows gently bent with the pillows placed between your knees. So you can see it right there. So she's on her left side. Like I said, you don't have to be on your left side. It's just optimal. It's okay if you're on your right side. Sometimes if you're concerned about baby and movement, and in your binders that you guys get, and it shows the fetal kit count, the instructions for that, and it says lay on your left side for that, that's one of the reasons why too, because it's supplying more oxygen and blood flow. So if you're concerned about baby and you're laying on your side, that's the best side to lay on, is your left side. And then semi-reclined shows this one and this one. This right here, I recommend only if you like this position. Only do it for your relaxation sessions. Don't be in this position a lot. Being in this position often during pregnancy encourages babies to either go posterior or to go breech. So because of the weight of the baby's head, it kind of encourages babies to go back and then flip over. So this is okay for relaxation, but not to stay in it for long periods.
What if they don't know? Like, what if they're in a good position and they don't change that?
I still recommend not being in reclined position often. It's just way better to encourage it, because even if your baby is in a good position, then if you're in this often, when it comes time for birthing, then they're not lined up as well. So it's just better. I'll show you. So if you're going to be sitting, so say you're watching a movie with your husband, or you're reading or whatever, working, I recommend getting one of these balls and sitting on this, because it encourages posture, good posture mostly. And then it gives a spread to your pelvis that's good for practicing and for exercise. You can move around, it loosens your hips. Like when I was expecting, and for a lot of my ladies, I say, use this for folding clothes. Like, put your clothes in front of you, because it's a really good workout. You're going like this, grab the clothes, folding them, putting them somewhere else. Or, if you're watching a movie, your husband can be sitting behind you, rubbing your shoulders, doing gentle massage, things like that. So it's a really good thing to do. If you're going to sit on the couch, and that's fine, prop some pillows behind you so you're not like really reclined. Just try to sit upright as much as possible. It's just much better for keeping baby in a good position.
I have a question. How important is the pillow between the legs?
It just helps to keep that spread of the pelvis.
Okay.
So you don't have to, if it's like uncomfortable for you or whatever, you don't have to do it. But sometimes even just a thin pillow or a blanket folded in half or something like that is better. Because also when you're expecting, your pelvis actually naturally expands too. So that helps to keep your knees from knocking. So it just kind of make your knees get more sore when they're touching during pregnancy than when you're not. It's not like a must. It's just a suggestion for it to be helpful. Okay, so breathing. Now we're going to talk about the sleep breathing again. Take a deep cleansing breath 2 or 3 times. So just what I say when you're doing the sleep breathing, take a deep breath in and then let it out, and then you count, and then do in, and then again, keep your hands here. Feel your abdomen rise when you breathe in. Okay, in to the count of 4, and then out to the count of 8, or just a rapid, it could be just count of 4 as well. A rapid count of 8, exhale. Make sure your abdomen rises and not your chest. Allow your eyes to gently close. Relax with each breath. We're reading over here in case you want to follow along. Visualize your breath drifting down into the chest, then your stomach, your pelvic floor, then down through your legs and out your toes. So you just want to just imagine that breath just going down through you and relaxing every muscle as it goes out. Slow breathing is used during the thinning and opening phase of labor. So again, the thinning and opening phase is that cervix thinning, so becoming thinner from here to here, and then opening up wider. Okay. Sorry, I lost my place. Inhale to the count of 20 and exhale to the count of 20. That's the goal, but most women don't get there. The idea is to just get as close as you can. You just want to have those nice deep breaths to work with the contraction or the surges that you're having. So they're gonna peak. They're gonna start building, and then they're gonna peak, and then they're gonna let go, release, and you're gonna have that interval. And so the idea is when you're gonna feel that contraction come on, you're gonna feel it starting, and that's when you want to start taking those deep, long, slow inhales, filling up your abdomen, just letting that breath go down around baby, letting baby move down, and then letting go of that breath around the count of 20 to work with the surges. Most surges, when you're actually at your birthing time, are going to be around 40 seconds to over a minute. So that's the idea. You're going to have those deep breaths that are going to go and work with each surge. Most women don't do that full breath through the whole surge, and that's fine. You don't want to be straining yourself. That will be counterproductive. You don't want to be straining so hard to get that breath in. Inhale to a count of 20 and exhale to a count of 20 that you're just like, this is hard. I can't do this. So that's why you want to work on it, just getting as much as you can, as high of a count as you can, and comfortable breaths. They need to be comfortable, they need to be calming, they need to be relaxing. So once you feel like you're getting those nice deep breaths in, and the same as with the sleep breathing, once you feel like you've gotten this down, just throw the whole counting thing out the window. The whole idea is to just deeply relax, release tension, and to be calm. And every time you exhale, that's one of the things I want you ladies to keep in mind, and husbands, when you're relaxing too with your ladies, when you exhale, that's when you focus even more on letting go of any tension you're feeling in any part of your body, using different zones and anchors and whatever works well for you. So this works well with your birthing muscles. While using the breathing, the rest of your body needs to stay loose and relaxed. So I think I already talked about most of this. When exhaling, direct your breath down and around baby and out. I've already talked about that. Avoid short inhales of breath. So you guys see on the movies where they're like, don't do that. We even have some people where the husbands or an aunt or a mother will be like, okay, this is how you need to breathe. And we're like, no, please stop. Not helpful. Not helpful at all. It's kind of a way of hyperventilating. And are you going? Okay, thank you so much. Thank you. It limits oxygen. It's not helpful at all. At any point in birthing, is that helpful at all? It creates tension. What was that?
I said we're in life. Right?
Yeah, we're in life, exactly. Give your breath and thoughts to your baby. Make sure your abdomen rises and not your chest. I know I say that a lot, but it's super important. Your lower ribs expand. So I know it's blurry down there. I'm going to try and figure this out next time so it's even better. The whole projector and screen. So here is birth breathing, and I'm going to send all of you a video that is, actually, let me see what time it is. I think I'm actually just going to show it because it's really helpful. We have a few minutes to show it. And I'll show you why, in this video, why it's called the slanted J. And you'll see what's going on with baby and why it's called slanted J breathing. Because it's the direction, you can see right here, the direction that the effort that you're working with your breath or your push. In the Hypnobirthing book, it says that you shouldn't have to push, and that you don't need to push. And I mean, it's not the exact verbiage, but they're saying that if you're pushing, you're not doing it right. I just want to tell you guys right now that most women do have to push to get their baby here. So I don't want there to be any false ideas that I'm not going to have to push. Some women don't. Some women don't have to push and they just breathe their baby down, and that's great, but a lot of women do have to push. So I just don't want you to think you're going to go to your birth and be like, oh, I'm doing it wrong because I have to push. So what the whole idea is to make sure that you're working with your breaths that you have, you're working with your body, and we'll talk about all this even more in detail the last class, and that you're directing those breaths and those pushes. So this slanted J breathing, it assists the natural explosive reflex or the fetal ejection reflex. So they're the same thing, they're just worded differently because it's a fetal ejection reflex is associated with birthing. So the natural explosive reflex is that reflex that you have when you're having a bowel movement and you have that urge to push with the bowel movement. That's a natural explosive reflex. So the fetal ejection reflex is similar, but different in a sense that oxytocin, which is one of the hormones that triggers and stimulates those pushing contractions, is building and getting stronger and stronger, and it's encouraging that pushing way stronger than you feel with a bowel movement and helping to move baby out. So that's why we call it the fetal ejection reflex. It's similar to that feeling that you have, those crampy, where you're stimulated to kind of curl and move that bowel movement. But with that bowel movement, this is a good way to practice it with before baby, is with that bowel movement you want to breathe in and expand this part of your abdomen and allow all of the muscles around your pelvis to relax, and then just open. And it might sound silly, but I promise you it works so well, especially when you get it right. and you allow all those muscles on your pelvic floor to just relax and just open and release. And that's how you can practice this slanted J breathing. And then you kind of curl in and you direct your bowel movement down and out instead of a forced push. So you allow that breath to work with you and soften all those muscles and direct that bowel movement out. And so it's the same idea with birthing, just more intense, and you'll be moving something a lot bigger out. A lot bigger. So, but it is a good way to practice it. It's very helpful to practice it with the bowel movement. So your baby's head presses on the receptors in the cervix and later in the vagina. So when the baby's moving through the birth path, after it moves through the cervix, and your brain receives the signal to release more oxytocin, which triggers that stronger urge to push baby out. And it's super important that you stay relaxed at this time because it is very intense, very, very intense moment. And a lot of women, when they get to this moment, then they usually want to clench because it is so intense, and they'll squeeze the muscles in their pelvic floor, and they'll want to move away from it. But it's so important to just keep everything super relaxed so baby can just move down through that birth path, and that reflex, that urge to push, you can work with the baby and through moving your baby through the birth path more easily. And the more baby moves down, the more oxytocin is released, and that stronger urge to push is created. So I know it's super hard to imagine and to really see what I'm talking about when you haven't been there. But when you get there and you have somebody there walking you through it and saying, okay, now this is happening, this is what you need to do here, it's really helpful. But at least you have an idea so that when they are talking to you about it at your birthing, and when it comes time to breathe your baby down or push your baby in the slanted J, then when they talk to you, say, now this is what you need to do, you're like, oh, okay, that's right. I remember, we talked about it in the class and I practiced it, and this is what I'm going to do. So it's an involuntary response that your body's going to be doing, and it's powerful and it is intense, very intense. And you want to wait for that to happen. Some women are encouraged to push before this happens, and it can lead to, before the fetal ejection reflex kicks in and is really strong, and it can lead to pushing for a really long time. So you want to wait for that to kick in. If you can. Sometimes if baby's compromised or whatever, you might have your midwife or caregiver say, okay, I know you need to push now, something like that. Then you listen to them and you do what they say for the safety of you or your baby. Mother directs her breasts rather than forced purple face pushing. Again, I've already talked about that, directing your breasts. It's important that you're allowed to work instinctively with your birthing body. If you allow this to build and become super strong, then it is instinctive. You can't do anything but push. And sometimes we have to tell ladies, okay, I need you to not push right now for one reason or another, and we'll get to that in the last class. And it's super important that you don't, but it is so hard. It is so hard to not push when it gets built so strong. But usually it's just for a couple surges that happens, and I'll talk to you about that in the last class. And you want to breathe and push this way only when in the surge, okay? Only when you're directed by your body or your baby. And you repeat it as many times as needed in a surge and let it build, feel it working. Practice this with the bowel movement. I've already talked about that. So I'm going to show you about this part right here. Repeat as many times as needed in a surge. Let it build and feel it work. I mentioned it a little bit in the last class, but I'm going to say it again. So the surge with the pushing surge is going to be different. You're going to start feeling it build. When you start feeling it build, you're going to start feeling that urge to push right about here. And it's going to become so strong that you can't do hardly anything but curl into it and just direct your baby right down and out, right here. And then it will let go a little bit. It'll give you like a few seconds break, and then it will do it again. Just direct you to just push or move baby down and out. Direct baby in that slanted J. And then it's going to let go again, just a little bit. You'll still kind of feel it there, but not quite as strong. And you'll get another breath. Oh, I forgot to say, sorry. Right here is when you want to take a nice deep breath in. And then when it builds and it's so strong and it directs you involuntary, then that's when you're going to, and so it's going to look silly me doing this, but it's because I love all you. So you're going to go like that. So you're going to feel it down through here and right through here and even down through here. If you're not feeling it down through there, then you're just pushing in your face and all of your energy is in your face and it's not going to move baby as effectively. Baby's working too, but you want to move with baby. You're going to do more. You're going to do a lot of work, and baby's going to do a lot of work. But baby can't do it on its own, most of the time. Okay, so you're going to do that. You want to feel it in your throat. You want to feel it down through here, right through here. And then it's going to let go, and you're going to... And then it's going to come on like that fast. And then you're going to take a nice deep breath in. You want to let it build to where you can't even resist it, and then you lean in and you do it again. People will be there to direct you, but like I said, the more you know now, the easier you will be like, okay, I can do this. And usually it happens about 3 times, that urge to push or that urge to direct your baby in the slanted J, to move baby down and out. Sometimes 4, and then it lets go completely, and the mother's just completely relaxed. We tell them to just take a nice deep breath in, and then blow it all off and just completely relax. And then they usually get about 30 seconds to a minute, and then it comes right back on again, and it just keeps happening until baby is out. And then it goes away until baby's born. So I know this is a lot, I know, but it's so important, it's so helpful the more you understand about how it works. So here it shows a slanted J. So I'm not going to show you the video, sorry, just for lack of time, but I will send it to your phones so that you can watch it. But so remember, when you see that video that I send you, this is what baby's doing. Okay, you can see that slanted J right there, down and out. That's how you're going to direct your baby with those pushes. Down and out. Okay, so again, like the picture I showed you, this is what's happening. Regular contractions, you're going to use that slow breathing. As your abdomen rises, and then as it goes down. So let me see if I've got. Okay, deepening is, again, like I said, is you're relaxing, but you're so deeply relaxed, it's almost like you're not aware of anything that's going around you. Not quite asleep, but like you're almost there. Every muscle in your body is so deeply relaxed. It talks a lot about this in the chapter in your Hypnobirthing book, but I just have some things that I normally, if we have more time, we'll go over, like light touch massage. I highly encourage each of you guys with your husbands to practice this. The light touch massage is so helpful. The whole idea is to kind of stimulate that goosebump response, or to where your hairs kind of stand on end on your arms and your legs. That creates endorphins. It releases endorphins. As long as you like it. But usually it's just a super gentle touch, and you want to move like down, or up and out, and then you can do figure 8 on the back and things like that. There's different things. This, like right here, is super calming and soothing to a lot of women. Like right here, so doing that for your wife is super helpful if they like it. This is what we call an anchor, so it doesn't have to be the hand on the shoulder. It can be something like just gently placing your hand on the forehead or behind the neck, or sometimes even both, and that's just like a trigger to go even more deeply relaxed. Sometimes it is like just on your shoulder or your arm or your leg, sometimes just feeling that hand. And it talks more about anchors in the book too, in the Hypnobirthing book. And then I show this one, the 1, 2, 3, because that's something that, something that a lot of women use, or even men. It's silly because you've always heard of counting sheep to get to sleep. But this is actually something that has been proven, not necessarily sheep, but sometimes just counting certain things and just counting them over and over again. All of a sudden, you're either asleep or super deeply relaxed, because it's just a distraction of all the other things that are stressing you or giving you anxiety. this is something that has been the most helpful. Well, the feedback that I've gotten is this has been the most helpful for a lot of people. People in the military actually use this, interestingly enough, to, you know how they do the sleep deprivation training for the military men. They use something very similar to this to when they actually do get a chance to go to sleep, to just fall asleep like that. So even though the idea isn't for you to just go to sleep, but you just want to be super deeply relaxed. If you do fall asleep, that's great. Whatever. It's not like you're doing it wrong if you fall asleep, but you do want to be so deeply relaxed that you could fall asleep. I mean, yeah, if you fall asleep, that's great. I don't mean to say that you shouldn't fall asleep, but that's awesome if you can fall asleep. Sorry. Anyway, so what you want to do is you want to imagine your body is sectioned into different zones, and you, as you're lying down on your side, on your back, whatever it is, and you have your music playing and the scripts playing, whatever, you just visualize the top of your head to your shoulders, every single muscle in and around there, completely loose and relaxed. And then once you feel like you've gotten that done, you move from your shoulders to your waist, and then continue on from there, moving those different zones. And I'm pretty sure that there's this picture or one similar to it in your hypnobirthing book. And if not, you can take a picture of it now to make sure, or ask me for it, and I'll send it to you. If you don't remember what the zones are. And it doesn't even have to be those specific zones, but it's just helpful that way. And you want to do it all the way when you're visualizing those muscles relaxing and being super loose, all the way to the tips of your toes to end it. Okay, I'm going to skip over that. I usually do a script, but I'm going to skip over it. So again, there's blue satin ribbons. I just put that in there. And then the balloon, I put that in there because you want to visualize your abdomen is expanding as if you're filling an inner balloon up. And then here's the opening blossoms. These are just some things to visualize. You can see baby moving through the birth path. And I'll talk to you more about this in the last class, but it is so neat. This is one of the most incredible things to see on earth. So I'll talk to you about it. When you could see that baby moving through the birth path right to the perineum, and you see baby's head, and it is so encouraging and so incredible. And then time distortion, talk to you about that. So that's something that naturally sets in if you're super relaxed and calm. This is the optimal birthing position. I just showed one of a drawing, and then one that's just a little bit more realistic. So again, find that picture in your booklet that I made up for you. Hang it somewhere where you're going to see it every single day, multiple times a day. Let's see. Okay, so affirmations. I don't know if you guys saw the cards on the walls, if you want to take a minute to read some of them before you go out. But those are affirmations. Affirmations are something that is read to you, or even better, that you read to yourself or you say out loud, that is positively reinforcing what you want for your birthing, what you want for your pregnancy, what you want for postpartum, all of it. It's positively reinforcing your goal, whatever it may be. And so it could be for so many different things, but here we're talking about birthing. So affirmations, there's several examples of affirmations in your booklets. And so really quick, there's breathing techniques here. It's a little rundown on it. It's also in for those of you who are coming to us for as midwives, it's in your white binder. I recommend reading over it. If you have any questions on any of it, let me know, okay? And then, so here's the affirmations. It says writing and using affirmations. That's here, so it has some of the same stuff here that I have on these slides. Be clear and specific. State exactly what you want. State what you wish to create, not what you want to change. So when you're writing your affirmations, don't say, I don't want this to happen. This is not going to happen at my birth. I am not afraid of this. I am not going to let this happen. So you want to keep those negatives out of it. Instead, you want to put this, I am this. My birth will be this. Things like that. So state it in the positive, and even better, state it as if it's already happened. Because the more you say that and over again, your brain will believe that it's already happened and make it happen. Like I was saying, use present tense. The affirmation is written for you and your baby only. Be sure to use I and my baby. Choose affirmations that resonate with you. Affirmations are something for you that you have control over in your life. So if it's something you have absolutely no control over, you don't want to put that in there. It is especially important to visualize the end result as you say your affirmations. So visualization is so important with these affirmations. Use words, if you're writing your own, use words that are going to stimulate visualization and imagery. And state them without a doubt. You guys have all heard the fake it till you make it. I think I probably even said it in the last class that it's real. Like, just even if you don't believe this for yourself, say it anyway. Say it as if you believe it and it's going to happen. Thoughts become things. So release your limiting thoughts. So these are just some other ideas of affirmations. If you guys want, you can take a picture of this screen because it's not in your booklets. It's not in there. But I just highly recommend you either get affirmations or create your own. I've seen many. This sweet girl that took my class in January, she had this super cute layout and first-time mom. And I actually asked her if I could take a picture of it. But it was just, she found them online, and she just printed out little cards and hung them up on little ropes on her wall, and it was really neat. So just because they are the ones that she connected with that made her, that sparked that visualization, that imagery, and made her feel at peace about her birthing and her pregnancy and postpartum. So, okay, we have just a couple minutes, I think. Nope, we don't. We're over. Do I have your permission to just go over this last slide really quick? Actually, I think there's, let me see. Okay, just so that last slide, and then I'll talk to you about this one. Is that okay? For like just a few more minutes. Okay, thank you. So gratitude was found to be related to physical health, psychopathology, emotional well-being, psychological well-being, and social well-being. So it not only just feels good to be grateful, it actually changes your whole chemical makeup to practice gratitude. And it's been proven over and over again for like psychotherapists, for lots of therapy professionals. People with chronic pain have healed themselves just with gratitude and stuff like that. So I really love, I believe that's what God wants us to do anyway. So those with chronic pain who practice gratitude noted an improved overall sense of well-being and a reduction in pain and even more speedy recovery. So prepare your mind to experience your labor. Start with daily prayers. Thank Heavenly Father for the opportunity to carry this precious soul. Of course, these are just recommendations. I just love it. I've just seen it work amazing things in birthing and pregnancy and even postpartum when women practice gratitude and give it to God. The more gratitude you have, the easier it will be for you to accept this labor of love and to experience it instead of fighting it. Keep a gratitude journal. Give this experience to Him and trust Him to carry you through this. So the gratitude journal, if you would like to, could be about anything in your life, and especially everything that's going on and all the different changes, whether positive or negative. Just be grateful for them and what you're learning from them. Okay, so this one right here, I'm not going to read all of it, but I have it in case you want it. It's like a prayer, affirmations, kind of two in one. So I actually have it for you, Brooklyn, if you want. So I printed it up. It's back there somewhere. Nope, it's right here. So you guys can take one before you leave if you want one. So I'm not going to read it all, but anyway, I'm just going to put it right there. You guys can take one before you leave. Okay, so next time we'll just start with this.